ערב טוב לכולם, לכל מי שהתחבר וככה הצליח להתחבר ללא קשיים טכניים. הבנתי שיש כאלה שלא מצליחים, אני מקווה שיתגברו על זה מהר ויצטרפו אלינו. אני מתחילה רק בכמה מילים קצרות על מנת שנבין מה הנושא שלשמו נתכנסנו, ואז תתחיל בעצם את החלק של הפרופסור. אז הנושא שלנו היום זה בעצם המיתוסים שיש בכל השוק של הביוסטימולטורים אל מול עובדות מדעיות ומוכחות, אל מול הרדיאס שאנחנו כולנו מכירים. ומי שמעביר לנו את זה זו בעצם אחת הרופאות הגדולות בעולם בתחום הביוסטימולטורים, זאת שחקרה, זאת שעשתה את חלק מאוד מאוד ניכר מהמחקרים של הרדיאס שגם קיבלו את ה-FDA, פרופסור יאנה יצקובסקיה, והיא תבוא ותדבר מהניסיון שלה מה נכון, מה הם שמועות, ובאמת ככה השוק היום מוצף בהרבה מאוד מידע שחלקו נכון וחלקו פחות. אז חשבנו לעשות באמת סדר בגלל ריבוי השאלות, ואני חושבת שהוובינר היום בדיוק בא במקום הזה. ואני שמחה להזמין את פרופסור יאנה יצקובסקיה. יאנה אלכסנדרובנה תצטרף אלינו ואני מעבירה לה את המיקרופון. במהלך הערב אם יהיו שאלות תוכלו לרשום אותם בשאלות תשובות שיש בעצם ברופליקה, ואנחנו ניתן לה לעבור עליהם ונענה על כולם בסוף במרוכז. שיהיה ערב מוצלח והאזנה נעימה. פרופסור אלכסנדרובנה.
Hello, I am happy to see everybody here, and I am happy to see everybody once again. I want to say you, if you want to ask me something, please, I will see everything what you ask me, and I hope that everybody hear me well, and if you have some questions, please, you may ask me in my lectures. And now I will speak with you about biostimulation effect of our fillers. You see, when I speaking with you about my practice, this is first of all a lot of doctors. In my clinic, Vladivostok, Moscow, Sochi, will working 548 doctors. That's why when I say you that this is our experience, this is not only my experience. This is first of all experience of my doctors in our country, and this is 3 different cities. These are cities near the ocean, Vladivostok, with 365 days with sunshine. This is a Moscow, such as a megapolis, and this is a Sochi near the sea with a very sunshine region. That's why when I say you that I speaking with you about experience, this is first of all experience of all over our clinics. Next. When we're speaking about stimulated of collagen, first of all, this is not only hydroxyapatite. This is PLL, PKL, and another product when we say collagenegenesis. But when we say neocollagenegenesis, this is terms only for hydroxyapatite. Why? Because hydroxyapatite stimulates young collagen. Next one. When we're speaking about another experience of another doctors, of another speakers, you may see some results, what we know today about stimulation of collagen, about fibroblasts, about effective of stimulation of collagens with different products. When we're speaking about hyaluronic acid, we may say that hyaluronic acid stimulates collagen. Next slide. But hyaluronic acid stimulates only old collagen, first type of collagen. That's why this is very short result, not more only than 1 month. Stimulated fillers. What fillers we know? Hyaluronic acid, and we may say that hyaluronic acid stimulates collagen, but this is very short stimulated. This is only old collagen first type. PLL, This is very interesting stimulate chemically, stimulate of collagen. And when we speak about PLL, this is first of all, we do not know how much they stimulate collagen, and we don't know the result with our patient. That's why we understood what the result of collagen, of stimulated collagen after only 3-4 months. This is collagen. When we're working with product with collagen, this is Nitia, Kalost in Russian, and another product. And when we're speaking about old skin, when we're speaking about fibroblast, we don't want to stimulate collagen. This is some disease of the skin. This is a dermatoporosis of the skin. That's why we may speaking about collagen, about such as a product, not about stimulated. And we're speaking about hydroxyapatite. This is neocollagenegenesis. Why? Because only for hydroxyapatite, we understood that we're speaking about two very important factors. First of all, this is 3 types of collagen. And next one, this is elastin. Next one. When we're speaking about volumization and biostimulation, you may see in my slide that we're speaking about skin quality, first of all, and hydroxyapatite, this is the most important for skin quality. PLL, the same, we're speaking about skin quality. Volume restoration, this is queen of volume restoration. This is, first of all, hyaluronic acid. Face contour, when we're speaking about contour and when we say term contour, this is first of all hydroxyapatite. Why? Because we may say about line of the collagen and we may speak about contour of the face and wrinkles filling. First of all, this is hyaluronic acid when we're speaking about wrinkles filling. And next one, this is elasticity of the skin, about elastin protein. And that's why we may say hydroxyapatite. Next one. What interesting today? First of all, this is neocollagenegenesis with radius. And next one, this is fillers for volume. When we're speaking about collagenegenesis, this is a king of collagenegenesis, this radius. And when we're speaking about skin quality, hydrolyzation of the skin, when we're speaking about volume, first of all, and next, this is quality of the skin. This is, first of all, hyaluronic acid. Periostal technique of hyaluronic acid. Next time. What is it, radius? Everybody knows this is, first of all, this is sterile, latex-free, not teragenic, cohesive injection dermal filler. This is 770% sodium carboxymethylcellulose. This is 30% calcium hydroxyapatite. Very important. Macrospheres 25, 45. And this is pH 7.4. When we say hydroxyapatite, this is, first of all, mechanical stimulation of collagenegenesis. And when we say hydroxyapatite, we may say that this is neocollagenegenesis. This is very important because it's different without different collagenegenesis product. Radius, this is the same filler, but this is mechanical stimulation of neocollagenegenesis. Next one. Action of the radius, first of all, immediately correction. And when we say about radius, this is immediately correction in this chair, in the room of the doctor. When we speak about PLL, this is not immediately correction. This is correction after 3-4 months. Next, this is stimulation of collagen. And we understood that this is through 2 effects. First effect, this is 3 types of collagen. Collagen type 3 after 3-4 months. And this is next step, this collagen type of 1. And this is stimulated after 8-9 months. That's why we may say that collagen stimulation effect, this is, first of all, collagen, and very important because it's only for radius. This is elastin. and stimulated collagen and quality of elastin after 3-4 months young collagen, and after 8-9 months old collagen. How long this collagen live? 1.5 years. That's why when we speak about stimulated of collagen with hydroxyapatite, we may say, first of all, neocollagenegenesis, because this is young collagen. And next one, we may say long-term effect, because this is 1.5 years with the first type of collagen what living in the skin. Next. Degradation of hydroxyapatite. This is not enzymic hydrolysis, and we understood that all patient, all skin, all tissue degrade hydroxyapatite 1 year. Sometimes 1 month long, sometimes 1 month early, but this is 1 year. Next one. This is my patient, and she sent me this photo. She do it photo with CT for another doctor for after mammoplastic. You may see this. And she sent me this photo after May 2021. She did this examination before, and you will see in photo in the face hydroxyapatite. And after 1 year in May, she doing this examination once again, and we'll see tissue without hydroxyapatite. This is very important for understanding. What about degradation of hydroxyapatite in radius? I don't know what about another product with hydroxyapatite, but when we're speaking about radius, this is 1 year. Next one. Radius with lidocaine and without lidocaine. If you ask me, I say you this is not so important for rheology of the product. But when we say radius plus, this is radius with lidocaine. When we say radius standard, this is radius without lidocaine. That's why lidocaine only for anesthesia, not for diluted. It's very important for understanding now in this slide. Why? Because when I say you diluted radius, this is diluted with saline solution. That's why we have radius standard without lidocaine, and we may do this ourselves in our clinic, and we may do 0.25 lidocaine for standard, mixed this radius, and we'll have new product. But this is the same rheology of the product. When we say radius plus, this is radius with lidocaine. Next. Radius and radius plus. The same effectiveness, the same efficacy, the same viscosity, the same rheologic product, only where this is more comfortable for doctor. Only this is more comfortable for patient, and only this is only for the pain. That's why radius or radius plus, this is the same product with the same result, with the same efficacy, and this is only different with lidocaine or without lidocaine. Next one. When we're speaking about changes, viscosity, radius, and another product, and you may see in my slide, high viscosity and elasticity of radius prevents the filler migration and helps to achieve optimal result with small fillers volumes. That's why if you say about viscosity on the skin, subdermal viscosity, superficial viscosity, more comfortable for the skin, this is radius. Why? Because this is without water. This is with product and with effective of stimulation. That's why if we're speaking about another product, this may be hyaluronic acid, but viscosity is not so high. Next slide. Radius and elasticity. Elasticity, better contact forces of factors for the course of aging of the face, such as gravity and skin laxity. That's why when you're working with patient with laxity, more better result you will have with radius. Why? Because it's more high elasticity. And if we're speaking about another product, hyaluronic acid fillers, maybe this is the same effect, but more better effect with radius. Next one. Next one. Next slide, please. That's why we're speaking about skin quality improvements. We're speaking about volume restoration. We're speaking about face contour. And we're speaking about wrinkles filling. First of all, skin quality. This is biostimulation product. We're speaking about stimulated of fibroblast activity. And we're speaking about new collagen and new elastin. Well, we're speaking about volume restoration. This is, first of all, working with quality of the skin, and we're speaking about skin aging, and we're speaking about wrinkles. Face contour. When we're speaking about face contour, we're speaking about the result of quality of viscosity and elasticity. As a result, we have a contour of the face without hydration. We're speaking about contour with collagen. And wrinkles filling, instant long-term effect of wrinkles filling. This is, first of all, activity of biostimulation of the protein of the skin dermis. That's why when we're speaking about wrinkles filling, this is, first of all, stimulated collagen in dermis. But we're working with subdermal line. Next one. Very interesting product, Harmonica. I know this product more than 10 years. This is not new for me. And I want to say you the different, first of all, because we're speaking about another product. We don't speaking now about neocollagenegenesis. We're speaking about only area of periauricular area. That's why this product do not recommend on another area. This is recommendation only for periauricular area. Why? Because this is hyaluronic acid and hydroxyapatite. Because we have some volume with hydration. That's why we can't work in the center of the face. That's why you must understand that this is not the same as radius. This is another product with hydroxyapatite. Next one. If we're speaking about another stimulator of collagen, we have a lot of products. This is not only hydroxyapatite. This is PLA, polylactic acid. This may be some new PLA, and you may see Estefil, Korean PLA, Sculptra. This is very is historical product, more than 15 years we know about this. And all this product is very different. Please, we'll see. The Sculptra is 73 micrograms in 1 milliliters. And Estefil is 40 micrograms to 1 milliliters. Repart, this is product for Russian country only. And Ghana product, very interesting, but only 15 milligrams for 1 milliliters. That's why this product can't stimulate collagen the same as Sculptra. That's why we have a lot of different product now. All this product may say that they stimulate collagen, but only radius may say that we stimulate new one collagen. This is neocollagenegenesis. This is very different for the result, for the long-term effect. This is very different to mechanism of stimulation, first of all. Next one. You may see historical studies of biostimulation effect, and you may see the result after 3, 6, 12 months. Here is the radius, here is Estefil and Sculptra, what I do it for you in this graphic. I twofold increase in the collagen type 1. Content can be observed already 3 months after radius injection, with the level maintained to the 6 months. You may see this for radius. This is more comfortable. And this very interesting research of our doctors from St. Petersburg, Dr. Bagnenko. Next slide. Next, very interesting about biostimulation effect. You may see here 3 months, 6 months, and 12 months. And this is elastin fibers and different time points. When we're speaking about radius, this is first of all stimulated of quality of elastin. And this is a higher data that estafil or sculptural stimulation. That's why I say that mechanical stimulation of elastin fibers is more clinically resultive. Next slide. You may see this here. The result after procedure and lower cost of treatment was with polyoxide acid and PLL and hydroxyapatite. This is a result after 3-5 procedures, result after 2 months. This is an effect of undesirable effect. And for PLL, this is not comfortable for the practice. This is first of all noodles. This is redness. This is pain. And when we speaking about calcium hydroxyapatite, any noodles. If you're doing everything well, you can't have any noodles with calcium hydroxyapatite. You must understand this. If you have some complications, this is first of all not comfortable practice, not comfortable technique. Next time. That's why, once again, skin quality improvement. This is radius. Volume restoration, subdermal radius. Safety, any granulomas. We don't have any information about granulomas. And pharmacoeconomic radius more comfortable for the long-term effect than harmonica. Why? Because this is a mechanical stimulation of collagen without hyaluronic acid, and this is all over the face. When we're speaking about harmonica, this is only periauricular area. That's why when we're speaking about pharmacoeconomic result, radius is the king of pharmacoeconomic result. Next one. Volumetric and biostimulation property of the product. Cross-link hyaluronic acid, PLL, non-modeling animal collagen, and calcium hydroxyapatite. Calcium hydroxyapatite, this is synthetic product. That's why we can't say any autoimmune reaction about any autoimmune or immunological
Professor
reaction.
YANA, for some reason we don't hear you.
Why?
So please repeat from the beginning of this slide, please.
Volume and biostimulation property of the product. First of all, cross-linking hyaluronic acid, PLL, and collagen, and hydroxyapatite. When we're speaking about biostimulation property of the product, most safety, this is hydroxyapatite. Why? Because it's mechanical stimulation of collagen. Because this is mechanical stimulation of fibroblast. And because it's chemical stimulation without hyaluronic acid together in one syringe. That's why when we say hydroxyapatite, we say neocollagenegenesis, we say collagen and quality of elastin, and we say activity of the fibroblast. Next one. Levels of the face. Very important trees. When Mendelssohn doing these trees, for everybody will understand everything about levels. We're working with you in skin level. And if you ask me what level of the skin, this is first of all subdermal level. You mustn't do dermal injection. You can do subdermal injection. It's very important for understanding of this technique. Next slide. Fast cell mapping. Once again, click once again, please. When we're working with the face, this is first of all upper of the face, medium of the face, and lower of the face. When we speak about radius, we are working with all over the face. When we're speaking about harmonica, we may working only with periauricular area. This is very small area for the face. That's why when we're speaking about collagen stimulation, we must speak about radius first of all. Next one. This is point for injection when I work with radius. This is point for volumetric injection. You may see Henderer point, you may see McGregor point. This is point for volume for periostal injection. Next one, you may see here zone C1, C2, C3. In all these zones, we may work with radius. Upper of the face, we do not work with skin, we work only periostal. Middle of the face, we work in periostal or subdermal. Lower of the face, we're working periostal or subdermal. That's why this product for all over the face. Next slide. Next slide. Next slide. 2 point. This is 2 point for periostal injection of radius is more better. This is Henderer point and this is McGregor point. For what? For orgy course. This one, when we're speaking about volume of the face, this is the first of all of the middle of the face. And here we're working periostal and subdermal in one session. This is comfortable procedure. Next slide. Very important line. This is Ricketts line. This is line for the working with the lips. Why? Because when we're working with this with lips, first step for us, this is nasolabial fold. Next step for us, this is chin. And only third step, this is lips. That's why first nasolabial fold, next chin, and only after lips. We do not work with radius with lips, but we work with radius with nasolabial folds, periostal technique or subdermal technique. And we work with chin with periostal technique. This is the most good place for periostal technique for the woman face. Why? Because we don't have edema, we don't have a lot of volume, we may have contouring of the chin. Next. We know that we have consensus. This is very interesting document for our practice. Global consensus, this is first of all for hydroxyapatite with dilution variant. Hydroxyapatite diluted, RD. This is term is for 1-to-1 diluted. When we say radius diluted, this is 1-to-1. When we say radius hyperdiluted, this is 1-to-2. That's why we have two data. First of all, this is radius diluted variant. For what? For safety, first of all. Because when we're speaking about diluted, this is first of all quality of the skin. That's why for safety of the result, we dilute radius because we don't want only volume. We want stimulated collagen, and some face do not want volume. If these face do not want volume, we diluted radius. That's why you may work in with radius without diluted. This is radius standard and radius standard plus with lidocaine. In this situation, you may have after your procedure volume and stimulated of collagen. If the patient variant of the face do not want volume, we recommend radius diluted. That's why radius diluted, this is stimulate collagen without volume. This is treatment of laxity without volume. And next one, radius hyperdiluted. For what? For skin, very thin zone. This is first of all, neck, décolletage, sometimes hands. That's why we have three variants. Radius standard plus, radius diluted, 1-to-1, and radius hyperdiluted, 1-to-2 and more. Next one. Don't sleep. Next one, please. Next consensus. This very, no, no, before, yes. Consensus before slide, because this is consensus very important. Yes, this one. This is hydroxyapatite calcium radius for body. A very interesting, face and body. That's why we may recommend this product for the another area. Not only face, not only neck, we recommend it for body. Abdominal zone, hands, legs, and another zone of the body. And next one, very important. We have here a palm rule. You may see point of palm rule. What is it? For this zone of our patient, 100 centimeters, we recommend how much microspheres? 1.5. We recommend for this zone 1.5 milliliters of radius. What diluted of this radius? This is your clinical case. You may dilute it 1 to 1, 1 to 3, 1 to 4, but very important, for this zone, quantity of microspheres must be 1.5 milliliters of radius. Next one. This is for diluted. Why so important diluted well? Because in the cheek, on the chin, on the neck, we have very different dermis. That's why when we're working with neck, this is diluted more than 1 to 2. That's why you might take 1.5 milliliters of radius and 3.0 saline solution. This is well diluted. You may dilute more if this skin very thin, if this patient more older than 60, 65. That's why we dilute it differently of quality of the skin, differently of zone. Next one. Diluted protocol. First of all, this is syringe, 5 or 10 milliliters. It's very comfortable, 10 milliliters. Lower lock. You must have connector and you must have saline solution. If you have radius plus, you mustn't take lidocaine. If you have standard radius without lidocaine before, you may take lidocaine and do it for 1.5, FDA recommendation, 0.25 milliliters lidocaine. Choice of instrument. This is maybe needle. This is maybe cannula. It's very comfortable for understanding that if you take needle, this must be needle only, please, only 2719. Why? Because this is, first of all, not fillers now. This is not gel. This is solution. That's why we working with long needles. 2719, not 30, not 32, not 25, 2719. Next one, this is a cannula. When we're speaking about cannula, when you work with neck, sometimes it's cannula 25. That is not very comfortable. More comfortable, I think, cannula 22 and most safety. That's why cannula 22, sometimes 25, and needle 2719. Next one. When we're speaking about instrument, very important, have a safety instrument. We have this publication, you may see this publication in PubMed. When we're speaking about safety, this is first of all using cannula 22. When I work with the face, for me it's more comfortable because I understood that I have some points on the face with very superficial artery. This is the center of the face, the arteria transversa. Some another places near the angle of the nose, arteria angularis. That's why I understood that 22 cannula is more comfortable for me. But if you want working very superficial, sometimes we may do this when we're speaking about neck. I think that cannula 22, you may have it in your practice with the radius or diluted radius. But cannula 27 is not safety. That's why cannula 27, no. Next one. Once again, rule of the palm. When we're speaking about quantity of microspheres of hydroxyapatite, we have rules for the result. Why? Because if we have a lot of microspheres, we have a mechanically stimulated of the collagen. If we don't have a lot of microspheres, we have stimulation, but not clinically visual. That's why one palm of the patient, this is 1.5 radius. And if you're working with the face, this is 3.0 volume of the microspheres. If you diluted this, you may dilute it 1:1 for the face. That's why 3.0 radius, 3.0 saline solution. Together, for the face, you have 6.0 solution diluted radius. If you work with some another zone, this may be 1 palm or 2 palm or 3 palm, if you see in my slide. Next one. Very important question. Control of the procedure. When we must see this patient? After procedure, I recommend you will see patient after 2 weeks or sometimes after 1 month. Why? It's very important. If you diluted radius more than 1:1, we'll see your patient after 2 weeks. Because if you have very superficial microspheres of the hydroxyapatite, you may dilute these microspheres in the skin with saline solution. If you do not dilute radius, it's comfortable with the patient after 1 month. Why after 3-4 months? Because when we're speaking about 3-4 months, this is a first result for the stimulator of collagen 3. This is genetically result. We don't know what we will see result in this patient. Only genetically mechanism is important. Only fibroblast genetically activity is important. That's why we may see after 3-4 months young collagen. First result for young collagen. Why 8-9 months? Because after 8-9 months, we will see with you first type of collagen. And this type of collagen, this is a stop result for this procedure. That's why we will see result after 8-9 months. And this result is for 1.5 years. Why? Because we stimulate first 3 type of collagen, third type of collagen. After third type of collagen stay first type for older skin, and after we will see clinical long-term effect 1.5 years. That's why not microspheres live in skin 1.5 years. Microspheres live in skin 3-4, sometimes 8-9 months, because we diluted product. But the result is long-term clinically 1.5 years. Why? Because we stimulate young collagen. That's why we may say long-term result. Next. That's why what I recommend you with the quantity of the procedure. First of all, if you're working with procedure with skin flexity, this is with skin flexibility, flabbiness, this may be every 3-4 months. If you're working with young patient, this may be 8-9 months. If this is prevention procedure, if we're working with dermatoporosis, this may be 1.5 years or maybe 1.5 years. That's why for treated of the skin, this is one procedure in 3-4 months. For repeat procedure for young patient for us, this patient with young skin, this is before 35 years. This is 8-9 months. If we work in prevention procedure or we treated dermatoporosis, this is 1.5 years. Next one. Face injection technique. You may work in if you want for Blasio lines, Rubin lines, Koch lines. I prefer two variants of the lines, Langer lines and Borges lines. When we work with Langer lines, this is lines of the skin tension. Everybody understood that this is first of all mechanical strength and elasticity. When we're working with Borges lines, this is first of all relaxation, skin tension lines. That's why if I work with patients with a lot of wrinkles, with very hyperkinetic activity of the muscle, I recommend you Borges lines. If I work with thin skin, if I work for stretchiness and for elasticity, I work with Langer lines. Next one. Face methodology. First of all, this is 1.5 milliliters per side. Please, understood me. That's very important for quantity of microspheres. If you take 1.5 milliliters for all face, we do not see the result clinically because we do not have a lot of microspheres of hydroxyapatite. That's why we recommend you 1.5 milliliters for per side. Per side 1.5, per side 1.5. Summary 3.0. What diluted we recommend? 1 to 1, sometimes 1 to 2, sometimes 1 to 3. Why? If patient have thin skin, we recommend you more dilution, but quantity of the hydroxyapatite must be 3.0. What is the injection technique? Deep of injection must be subdermal. What instrument? That may be needle or maybe cannula. If you want do punch to the cannula, this needle 21. Next one. When we're speaking about temporal area, for me, it's important for my practice. I recommend you radius diluted subdermally injection, radius diluted 1 to 1 for lifting. Sometimes I recommend you subsmass injection. In this situation, you may speaking about volume, and you may recommend hyaluronic acid. This may be bilateral volume. Why not? If you're working together two technique, you may do it subsmass hyaluronic acid and subdermal injection for the skin, for the quality of the skin, radius diluted 1 to 1. Next one. This is technique for temporal zone. Here you see a 2 point. You may work with frontal area, and you may work on from zygomaticus point. This is for quality of the skin, and this is for muscularization of the muscles. And we may work in here with cannula, and I recommend you only cannula 22. If you ask me what dilute is comfortable for me, this is diluted radius 1 to 1. Next one. Next variant. This is working near the infraorbital region. This is not TIATRAF. Very important for understanding. This is not TIATRAF technique. This is pedal technique for infraorbital region. This is periostal technique without any diluted. We're working with standard radius or radius plus with cannula 2270 for the volume of infraorbital region. But once again, this is not for TIATRAF. This is another technique. Next one. When we're working with nasolabial folds, we understood with you that we have very important artery here. This is angular artery. That's why if you're working in the central of the face, if you're working with nasolabial folds, I recommend you in this situation only cannula 22. This is most safety instrument in the angle of the center of the face. Next one. This is a restore space, and I recommend you here. Sometimes if you want volume without hydration, I recommend you radius standard or radius plus This is periostal injection. I recommend you here volume 0.4. If you work with all area, this is 0.8. And I work here with standard radius without any dilution. This may be radius plus, and this is cannula 2270. This is restore space projection for volumization, periostal technique. Next one. If you don't hear me, you may have such complication, and this is not comfortable for patients. It's not comfortable for you. Please think about complications. I recommend you working only with cannula 22. You can't have any problem with this cannula. If you're working with needle, thinking about this situation, you may have some complication in this area. And this is a very big percent of the complications. Next one. When we're speaking about chin, for me, this is cannula in any situation. When I work subdermally, I diluted radius with 1:1. For me, this is volume 0.8 milliliters. I don't work with chin with needle. I work only with cannula. And you may see that here, cannula 2250, not 70, because 70 is very long for my practice. That's why this is subdermal injection of the chin with cannula with radius diluted variant, RD technique. Next one. This is another result. This is another situation of the working. This is periostal injection. And we work here with cannula 2250, but not subdermal. This is periostal boluses technique. And here, any dilution. We're working with radius standard or radius plus. And here is the full volume of the chin. We're working under the muscle, mentalis muscle, and I recommend you here bolus technique, 0.8 milliliters of the radius without any dilution. This is for the contouring of the chin, and this is for the volume of the chin. Next one. If you don't hear me, if you do not know anatomy, you may have such complications. Please working with the chin only with cannula. We can't have a safety practice here if we take a needle. If we take needle 27, this is danger technique for the lower of the face in any situation. If you take more big needle, this may be needle 25, 21. All this needle is here may provocate for you in this situation, provocate for you complications. That's why I recommend you only cannula 22. We published this clinical case. You may see this in my club, in my library of the club. This very interesting clinical case with a patient in Moscow. Next one. When we're speaking about angle of the mandibular angle, about angle of the face, we're speaking about under the muscle technique. And here we do this point for the volume. That's why I recommend you cannula 2270. This is radius standard or radius standard plus. This without any diluted, 0.6, 0.8 milliliters. This per injection point here 0.68 or 0.68. That's why summary 1.5. This is a man technique. Why? Because this is a volume technique of the lower of the face. And this is a radius standard. Next one. If we're speaking about women, this is another situation. We don't want volume. We want contouring. That's why from the point of the zygomaticus line, we work in subdermally with cannula 22, and we will do not bolus, because bolus, this is for periostal technique. This is drop. We will do big drop, and this drop may be 0.3 milliliters. If you're working with per sides, you may work in 1.5 per side, but for the drop, this is 0.3. Cannula technique, 2270. This is woman gender technique, and this is for the contouring of the angle of the mandibular. Next one. If we work on parotid wrinkles, if we're working with perioral area, if we're working with area for parotid wrinkles, and we have a lot of wrinkles here with patient after 45 years, excuse me, I recommend you needle. Why? Because here, this is a zone for gravitation standard zone. This zone don't have gravitation ptosis. That's why we have skin here with wrinkles without gravitation ptosis. That's why more comfortable working here with needle. This needle may be 2790. I recommend you dilute it here radius 1 to 1. This is maybe sometimes cannula, but if you take cannula, I recommend you 25. What volume of the radius for periauricular area? 0.8. Diluted 1 to 1, periauricular area with needle. 2719. Sometime I recommend you cannula 25. This is for parotid wrinkles. Every patient after 40-45 years ask us about these wrinkles. Next one. When we're speaking about air, it's very interesting technique. When I come to you, when I've been in your country, I think 3 years ago, one doctor say me, why you working with needle, with auricular? I say, because it's comfortable for me. But after, I will see some publications with reflexotherapy publications and understood that needle here is not so safety because we have some points in our auricular for pain point, for another point. That's why I understand it's more comfortable working with needle, with cannula. And now I recommend you for auricular working cannula 25. Why I write here 22? For you for understanding that 22 is more safety, but 25 is more comfortable for this zone. That's why auricular working, you see a green point in my map. Here we're working from this point for all auricular zone, and I diluted radius here 1 to 1, 0.8. Why I don't recommend you hyaluronic acid? Because we have a very big gravitation of this zone. And when we stay more older, we have more big auricular. That's why I don't want volume. I want contour. If I say contour, this is radius. Next one. This is a variant of the working with the man face. We will see here gender mapping of the face. We will see here gender variant of working with the man face before and after. This patient say me that he want have more brutal face. And I work with him with this technique, what I show you in my slides. Next one. This is a woman face. And here we don't speak about volume. She say me, I want have more contouring face. That's why I'm working with her face, such as woman face, first of all. And next, see to the medial and the lower of the face. We're working not without volume. We work with contouring. And this is radius standard. Next one. This is the more older patient. This is not my patient. This is patient of the doctor of my clinic in Moscow, Saibel Anastasia. And you will see that she working with this face with radius diluted technique. Why? for the structure of the skin. Because when we say word lifting, this is first of all plastic surgery world, you see. But when we're speaking about quality of the skin, when we're speaking about radius, we're speaking about structure of the skin. Why? Because we have a lot of new elastin, we have a lot of new collagen. That's why this face stay more younger after structure of the skin. And this very beautiful result for this age, I think. Next one. This is the quality of the skin. This is my patient before and after. And I working with this patient with diluted 1:1 for all oral face. This is 2 procedure. First procedure, after 3-4 months, next procedure. And I show you photo after 8 months. We have a lot of new elastin. And this quality of the skin is majestic, I think. Next one. This is another patient from my clinic, and you may see here that we're working with standard radius without any diluted, but you may see that we have a volume, not only quality of the skin. I work in subdermally, and I see, and my patients say, I have some volume on my folds, and I want more good quality of the skin. I say, okay, in this situation, we're working with standard radius without diluted. And here we're working with all over the face, only frontal zone we don't working. And here we have 3.0 milliliters of radius in vector technique for the zygomaticus point. Next one. This is very interesting patient. So she's speaking about gravitation. She's speaking about lower of the face. And I say for her, okay, we're working with you in 2 levels. First level, this is Henderer point, and you may see a redness point in her face. This is after procedure, 10 minutes after procedure. This is periostal technique to Henderer point, and this is contouring technique, what I showed you before, for the woman face, for the angle of mandibular. That's why I recommend you thinking about combination when we're working with periostal technique and when we're working with contouring technique for the patient. And she say, okay, I see this very good result now. Next one. This patient only for radius hyperdiluted. Why? Because this variant of the skin very thin, and this is wrinkles type of the typing of the aging. Wrinkles type, wrinkles morphotype. That's why I diluted radius here 1 to 2 for the face. I working with patient with volume of the radius 3.0. I diluted radius 1 to 2. And after I have 9 milliliters of solution, and I working with all face, you may see all faces redness after procedure, and this is the result after 3-4 months. Redness is maybe 1-2 weeks, because I working here with needle. We may have some bruises, small bruises all over the face, and you may see here result after 3-4 months. Once again, this is structure of the skin. Next one. That's all, my friends. I'm happy to see you today, and I'm happy to working with you. And I think that we may see each other after maybe sometimes. And if you want, ask me something. If you want working with me, and if you want to see my publication, please do photo of this QR code now and come into our club, come into our library. And I want to say, please, peace, this is most important for us. We thinking about you every day, and we want everybody everybody we want live in peace. I love you very much, and I come to you with best pleasure and anytime I may. Thank you very much for your attention today.
Thank you very much, Professor Yana YUTSKOVSKAYA. It was wonderful and very, very interesting. And now if someone has some question to ask, I think it's about time. I think we have one question.
Yeah, I see this question, NCTF with hyaluronic acid. You see, I know about this technique. This technique work in one doctor in America. I know him very well. I think that is interesting. Why? Because NCTF, that is a lot of amino acids. That's why you may do this diluted, but we don't have any research with diluted with NCTF. We have only the result clinically. That's why I think it's now more comfortable and more safety diluted with saline solution. But I know about this technique, and maybe in future, if we have some result after research, we understood that this is well too. But I know this technique, and you may do this. But this is only clinical case. I don't understand if they write something not in English. I don't understand.
I think no, it's in English. I think
Okay.
Professor. No, it's not an answer. It's not a. I think we have another one.
Nitya with radius. We do not dilute it, Nitya with radius, but if you're working with Nitya, you may do Nitya before or after radius, but you must understand that Nitya, this is collagen, not stimulated collagen. This is for patient, if you understand that we can't stimulate. In this situation, I recommend you Nitya. Now, yes, I understood that now diluted hyaluronic acid with hydroxyapatite. This is hybrid technique. I know about this, Evgenia. Sometimes I dilute it in my practice for the hands. Hydroxyapatite with bilateral soft. But you must understand that this must be a lot of must be a lot of hyaluronic acid, because if we don't have a lot of hyaluronic acid, we may have some complication. If I do this diluted, I recommend you 1.5 hydroxyapatite and minimum 2.0 bilateral soft. 1, 2 of collagen is only 5. Yes, Daphna, one type of collagen living in our skin 1 year and a half. That's why when you do this procedure, you understand that after 3-4 months, we have 3 types of collagen. After 8-9 months, we have first type of collagen. This is first step. And after these 8-9 months, plus 1 year and a half, this is the result. That's why we say long term. Radius with laser. Ladies first. All time when you're working with radius, you must understand that this is first of all stimulate collagen. That's why any laser before. If your patient have radius, and after you thinking when laser, after 3-4 months. Why? Because first 3-4 months, this is very young collagen. After 3-4 months, this is old collagen, first type, and you may do laser. That's why after radius, laser after 3-4 months. Scar tissue after acne. Correctly, we use after acne, after acne scars. I recommend you radius diluted 1 to 2, sometimes 1 to 3 for the face every 3-4 months. What you thinking about cheekbones? What you thinking about cheekbones?
The hybrid
augmentation with grid fillers. You see, if you're working with bilateral volume periostal, I think that interesting. If you're speaking about cheek and about subdermal injection, This is not comfortable. Why? Because bilateral volume, it's very, very viscosity and elasticity product. You will have problems with muscles in the cheek after such procedure, because this is cupirosis, first of all. That's why if gibrid filler radius plus bilateral volume periostal, yes. If gibrid filler radius and bilateral volume subdermal, no. The question was about sensitive hydroxyapatite versus why I say you about this, that why not sensitive hydroxyapatite. What about radius and bilateral revive в одну процедуру? This very good variant, and I say you that yeah, I know that Sonia Sattler, she like bilateral revive very much. I don't have revive in my country, but I work with revive in Ukraine, and sometimes before, and I work with revive now in Italy. I think that it's very good combination. Why? Because the revive stimulate hydration of the skin, and radius stimulated collagen. Together, this is a very good result. Any recommendation for post-procedure treatment massage? Why not? But if you do everything well, you can't do massage. But if you want to recommend this for patient, why not? But this is not such as PLL. For PLL, we recommend for every patient massage. For the radius, no. Спасибо. Тут кто написал мне на русском, я благодарю вас, я рада, что вам помогаю. Teaming with radius with RF microlifting for neck. Yes, RF it's very good combination, but if you're working with neck, you must understand this is a very thin skin. That's why this is not in one session. You may do RF and after 1 month radius. But not another situation. If you do it radius before, this is 3-4 months and only after RF. I say you why with laser. Is it indicated for use together with dermal threads? With dermal threads, everything after threads biodegradation. Why? Because we understood that threads stimulated some another type of collagen sometimes. And I don't know what is the product of the threads. We have a lot of products with the threads. How I can resolve radius after complications? You see, I think that you must say, Diana, that I've been working with you about complications with radius, because this is another lecture. You see, this is more than 1 hour. That's why ask, please, one more webinar. And I say you about complications, about a variant of complications, and about treated of complication. The recommended doses of for the different areas, upper side. Upper side. The doses, only one rule, palm rule, 1.5. Everything another, everything about diluted, this is only skin quality. That's why if you have thin skin, you dilute it more. If you don't have symptoms of thin skin, you may dilute it 1-to-1. What do you say about combination radius and Morpheus treatment? Kira, this is very good combination, but once again, Morpheus is a very big inflammation for the skin. It's very good, but I do not recommend you in one procedure. If you did radius before, I recommend Morpheus after 3-4 months. If you do Morpheus before, I recommend you radius after 1 month. Jacobi, Altera, radius, what first? Ladies first. Ulcera and after radius. If you won't do it in one session, why not? But Ulcera first and after radius. How many injections I may recommend you for that? This is the clinical case, Daphna. If you see that skin is very laxity, I recommend you 3-4 months and 3 procedure. Procedure, 3-4 months, procedure. 3-4 months, 3 procedure. Minimum 2-3 procedure in protocol. If not so laxity, this may be procedure, and after 8-9 months, next one. Ждем вас. Я приеду обязательно. Я очень к вам хочу. Я очень собиралась. И поверьте мне, я очень за вас переживаю. Я постоянно о вас думаю. Я очень вас люблю. И я очень хочу, чтобы у нас всех все было так спокойно, чтобы мы могли быть вместе. Я сразу, как только смогу, я сразу к вам приеду. Я вам обещаю. After 3 months, radius. You see, I know this study about scalp stimulation, but you must understood. Then type 1, scalp stimulated type 1. This is not long-term living collagen. That's why it's very important for quantity of the 3 type of collagen. When we see stimulated for radius, you may see this in our research and in our publication of 14 years. We have this first publication with Juvederm volume, and we will see that after 3 months, we have a higher stimulation of third type of collagen. And only after 8-9 months, we have first type. That's why radius have more big stimulation and more long stimulation than Sculptra. But Sculptra, this is 2 stimulation collagen product. Not diluted. Where are you using not diluted? I use not diluted when I have indication volume. This is maybe not diluted subdermal product and subdermal injection, and this is maybe not diluted periostal injection when I do not speak about volume. Друзья, с наступающим! Спасибо вам за вопросы. Мне очень приятно что вы хотите знать. Я очень хочу рассказать, потому что сейчас очень много практики. Я благодарю Диану и благодарю компанию, с которой я работаю, за то, что они меня позвали. И я очень хочу быть с вами. Поэтому я скажу «да» на любой вебинар, который у меня запросят. Thank you very much for your attention. I hope that New Year is for everybody. This is very happy year, without any war, without any problems for everybody. And for you, for your child, for your families, for everybody. Only peace. I love you very much.
Спасибо вам большое за вебинар, за то, что вы нам сегодня дали все вот это знание, и мы вас очень любим и ждем в Израиле. Thank you
Я
very
обязательно
much.
приеду. Спасибо вам за то, что приглашаете, Диана. Я всегда с вами. Спасибо.
Good night and thank you for joining us.
Good night and Happy New Year.
Happy New Year.